Welcome to the Model of Care training on the Chronic Care System of Care. The Model of Care program guarantees that care is delivered to patients at the most convenient service layer across the Kingdom of Saudi Arabia. It is comprised of 6 systems of care, which cut across the 6 layers of care, from activated person through to specialized hospital care. The model of care will be delivered through 42 interventions, some of which cut across systems of care, while others are system of care specific. Today's module will focus on the chronic care system of care. By the end of this module, you will understand what the model of care interventions for chronic care are, as well as some international best practices for chronic care. Historically, chronic care faced 4 main challenges in the Kingdom of Saudi Arabia. First, there was weak early detection of chronic conditions, in part due to low awareness or availability of national guidelines. Second, there was a low education and awareness among the public about chronic conditions and the existing services to care for them. And finally, a lack of care coordination, unavailability of home services, as well as a lack of resources in PHCs and suboptimal distribution of resources also contributed to the challenges. The chronic care system of care will support people with their chronic conditions by providing integrated care and ease of patient flow between care settings, and by promoting care at the appropriate setting through the implementation of 3 chronic care initiatives. Chronic disease screening, to establish periodic medical checkups and screening to promote early detection of chronic conditions. Case coordination, to support patients across different care levels and settings. And continuing care services, to provide access to a wide spectrum of medical and non-medical services through community-based facilities and to educate people to manage their care. The chronic care system of care will also be supported by implementing a cross-cutting initiative, the Enhanced Primary Care Services, to better support patients in their communities closer to home. Let's look in more details at the chronic disease screening intervention. The chronic disease screening intervention promotes accessibility, offers early diagnosis, and ensures adherence to national guidelines. For any chronic condition, patient outcomes greatly depend on the timing of diagnosis. The earlier a disease is diagnosed, the earlier the efficient management starts, thereby reducing the risk of complications. Under the chronic disease screening intervention, awareness and education campaigns will encourage the general population of people without any known disease to be screened for common conditions, while targeted screening campaigns will focus on additional screening for high-risk population according to risk factors. Chronic disease screening will be delivered in the community and in primary care. In the community, the efforts will be focused on early diagnosis and increasing the awareness towards screening by bringing screening facilities closer to the communities and providing numerous avenues for screenings, such as in malls or pharmacies, as well as increasing awareness and promotion of screenings through media and social media campaigns, and by linking standard health checks to workplace contract renewals. In primary care, early detection and screening will be at the cornerstone of all efforts. Early detection will entail that all PHC attendees should get screened on prioritized conditions. Screening in PHCs will encompass all common cardiometabolic risks, depression and anxiety using standard tools, and follow-up of ongoing care management. For example, patients with identified hypertension will also undergo screening for complications of hypertension, such as renal function, ECG, potential ECG stress test, and echo for high-risk patients. To fulfill its mandate, the chronic disease screening intervention will rely on its workforce, including nurses trained on relevant screening procedures and taught the national guidelines, as well as project managers that will manage screening initiatives and awareness and education programs. It also relies on the right technology to integrate through EMR, virtual self-care tools, virtual education and navigation tools, SMS reminders for patients, and smartphone applications to allow remote monitoring, scheduling, and follow-up. The intervention also relies on the investment required to implement screening initiatives in the community, as well as on partnerships by working with schools and other private sector partners such as pharmacies. Now, let's turn our attention to the case coordination intervention. Case coordination will facilitate efficient navigation and referral through the system by assuring patients are in the right place at the right time, and will reduce the number of unnecessary visits to hospitals, as well as the number of complications per patient through effective care planning and coordination. Enhanced PHCs equipped for treating and managing chronic conditions will be the primary location for managing chronic conditions, including supporting patients in guided self-care. A patient diagnosed with a chronic condition without major complications will be managed within the PHC. There, he will receive advice on healthy living, will be prescribed medication, and will have scheduled follow-ups. If the PHC has determined that the patient may have complications and need more specialized tests or care, then they may be referred to an outpatient clinic if it is clear what type of specialist the patient needs to see. The criteria for such referral needs to be stringent. At the center of this intervention are case coordinators, sitting in primary care and working closely with the primary care physicians responsible for their patients. Case coordinators will coordinate patients between PHCs, as well as secondary and tertiary care services, and will have the appropriate authority to refer patients across them. To fulfill its mandate, this intervention relies on strict referral guidelines, trained coordinators, and better IT integration to enable feedback between providers. Let's now look at the continuing care services intervention. Continuing care services ensure that patients have access to a wide spectrum of medical and non-medical services to support them at home or in the community, and will educate patients and their families to enable them to self-manage their condition. Continuing care services will include community care, both residential and non-residential, as well as home care services. In the community, care management focuses on lifestyle measures. Ongoing reassessment and care management will be provided for the highest risk patients to ensure adherence to medication, adherence to follow-up appointments, and adherence to lifestyle changes like diet and physical activity. This could be facilitated through ongoing nurse support or through home monitors provided to patients so they are able to manage their own vital signs on an ongoing basis with the help of virtual self-care tools. Under certain circumstances, a patient may require ongoing care in the comfort of his home, usually through visits from a nurse and a physician only under specific conditions. Home care would be focused on more complex cases, such as disabled patients, elderly patients over 75, or patients with limited access to services. This would provide patients with special needs support to continue living independently in their own homes, and could include home-based and multidisciplinary end-of-life support as necessary. To fulfill its mandate, continuous care services will rely on clear guidelines to refer patients to community services or home health care, and on investment in the workforce to ensure success. Home healthcare workers will need to be hired and trained on managing chronic care patients with comorbidities, and there will also be a need for social workers, nutritionists, and health coaches to help manage patients on a home care plan. The intervention also relies on the proper technology to enable better integration and follow-up through EMR, virtual self-care tools, virtual education, and navigation tools. Finally, it also relies on other model of care interventions, such as national guidelines, national referral system, enhanced primary care services, enhanced home care services, and step-down and post-discharge services. Finally, let's focus on the Enhanced Primary Care Services intervention. The Enhanced Primary Care Services intervention ensures that patients have access to primary care services through primary care centers or through mobile clinics to improve outreach in the community. Primary care services will be a patient's first point of contact with a physician closer to home and will be expanded to include a wide range of services, including chronic care, urgent care, end of life, prenatal, maternity, and postnatal care, screening, well baby, mobile clinics, minute clinics, and other specialized support services. To fulfill its mandate, the enhanced primary care services will rely on developing guidelines and raising public awareness to promote the use of primary care services. On enhancing the integration of primary care facilities with other healthcare facilities by effectively implementing case coordinators, developing integrated personal health records, and by establishing data collection and quality monitoring. It also relies on enhancing the infrastructure of primary care centers. And finally, it relies on developing the necessary workforce through recruitment and training to establish multidisciplinary teams and increasing exposure of medical students to primary care centers. Looking at international benchmarks for chronic disease screening, the National Healthcare Service in the United Kingdom runs a health check program which targets the 4 highest burden diseases in the UK, with a free checkup every 5 years. As a result of the NHS screening program, about 2,500 heart attacks or strokes were prevented in the past 5 years. 1 out of every 27 screened people was diagnosed with high blood pressure. 1 out of every 110 was diagnosed with type 2 diabetes. And 1 out of every 265 screened people was diagnosed with kidney disease. Now, thanks to this program, all these people know how to manage their disease. In Germany, disease management programs, or DMPs, are in place for 6 conditions: type 1 and 2 diabetes, asthma, CHD, breast cancer, and COPD, and support a total of 8 million patients, 50% of which have type 2 diabetes. 100 insurance companies partake in the DMPs, and a record of 180 million data points are stored as part of the program. DMP's recommendations are mandatory for providers, and GPs play an important role in enrolling patients in that program. The outcomes have been more than positive, as it has been proven that patients enrolled in DMPs are more likely to receive guideline care and are expected to have better outcomes. Home health agencies in the US provide a bundle of 5 main services. The first service is skilled nursing and case management, in which patients and their families are advised on how to manage their illnesses or injuries, explaining the post-treatment home care needs, including diet, nutrition, and exercise, as well as establishing their care plans. The second service is physical, occupational, and speech therapy, while the third service is medical social work, whereby patients and their caregivers are matched with the appropriate community resources covering finances, medical bills, and other daily activities required for independent living. The fourth service is home health aides or assistance with personal care, while the fifth and final service is the provision of essential medical supplies needed to carry out a home care visit, such as catheters or dressings, and the arrangement durable medical equipment delivery, such as walker, wheelchair, hospital bed, and oxygen. In Canada, the Healthy Together Now program is a community-led, regionally coordinated, and government-supported program to help prevent chronic diseases with a focus on 3 common risks of chronic diseases: smoking, physical inactivity, and unhealthy eating. The program aims to support communities that lead prevention activities, as well as encourage organizations, communities, regions, and governments to work together to prevent chronic diseases. The program also builds on and blends with existing prevention programs and develops new ones where needed. Finally, the Healthy Together Now program increases communities' knowledge and ability to run prevention programs for a variety of chronic conditions. International benchmarks such as the United Kingdom, United States, Germany, and other countries were selected to inspire the thinking to shape the implementation of chronic care initiatives in your clusters, to help more patients across the kingdom receive better care and learn how to manage their chronic conditions. This concludes the module on the chronic care system of care. You should now have an understanding of the scope and objectives of this system of care and its interventions. Thank you for watching.